Coronavirus is a family of viruses that typically cause mild respiratory illnesses in humans. This is the same family that caused the acute respiratory diseases SARS-CoV, severe acute respiratory syndrome, and MERS-CoV, Middle East respiratory syndrome. The most recent coronavirus, COVID-19, began as an outbreak in Wuhan, China, and has currently spread to over 184 countries with 71,000 deaths. In the United States, the mortality estimates vary widely. The White House task force recently projected millions of cases and 100,000 to 240,000 deaths. Coronavirus disease is thought to spread predominantly through respiratory droplets when an infected person coughs or sneezes. These droplets can travel through the air for about 6 feet and can contaminate surfaces for days. Public health officials initially reported that the virus was most contagious when a person is symptomatic sick. However, the virus can also spread before a person shows symptoms, a stage called pre-symptomatic. A pre-symptomatic stage can last for 2 to 14 days, but on average last 5 days. Recent studies from Japan and the Diamond Princess cruise ship have also indicated that many people who have the disease are asymptomatic, showing no outward signs or symptoms of feeling sick, but test positive for the coronavirus disease. Additional studies have indicated that individuals that are pre-symptomatic and asymptomatic can transmit the virus to others unknowingly before any signs or symptoms. Because of these new findings, the CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, like at a pharmacy or grocery store.
Amid scenes like these across the country, tonight the Coronavirus Task Force is now asking all Americans to voluntarily wear non-medical face coverings while out in public.
So what is our best way to counter a disease that has a high rate of transmission and can cause severe respiratory illness and death in our older and vulnerable populations? Our public health officials insist that the best approach to counter coronavirus disease is to know basic facts about the disease and practice social distancing. Social distancing is deliberately increasing the physical space between people to avoid spreading illness. The Centers for Disease Control and Prevention recommends these steps to be taken to protect yourself and others. Listen and follow the directions of your state and local authorities. Clean your hands often. Wash your hands with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at high risk for getting sick. These people include women and men over the age of 60 with chronic medical conditions like heart disease, diabetes, and lung disease. Avoid touching high-touch surfaces in public places like elevator buttons, door handles, handrails, and handshaking with people. Use a tissue or sleeve to cover your hand if you must touch something. Wash your hands after touching surfaces in public places. Avoid touching your face, nose, and eyes. Avoid crowds, especially in poorly ventilated areas. Your risk of exposure to respiratory viruses like COVID-19 increases in crowded areas, closed-in settings with little air circulation, and around people who are sick. Do not visit public places if you are sick. And always stay at least 6 feet away from others. Our local, county, and state officials have taken the concept of social distancing seriously. On March 23rd, the St. Louis County Department of Health issued the stay-at-home order with the intent to ensure that the maximum number of people remain in their places of residence to the maximum extent feasible. More recently, Governor Mike Parson issued a statewide Stay Home Missouri order effective at 12:01 a.m. on Monday, April 6, 2020, until Friday, April 24, 2020. The order explicitly states that individuals currently residing in the state of Missouri shall avoid leaving their homes or places of residence unless necessary. In order to reduce the risk of developing coronavirus disease or unknowingly transmitting it to others, we must work together and embrace social distancing and reduce community transmission. Unlike cancer or cardiovascular disease that can sneak in unannounced, if you simply stay at home, you will survive this scourge. COVID-19 deaths for the state of Missouri are sobering, with over 350 deaths projected by mid-June. We must do everything we can to minimize the unnecessary loss of life and family. Embrace social distancing. This is your healthy wellness message.